Hello everyone, my name is Nancy Basker and I'm a public health educator in Afghanistan. The focus of this presentation is going to gain a better understanding about maternal mortality in Afghanistan. To put into perspective, young women in Afghanistan, particularly from the rural and deeply conservative areas, suffer from one of the most highest rates of maternal mortality in the world. They are likely to die due to causes related to pregnancy and childbirth. Since it is common for women to get married early, they tend to have babies very young and very frequently. There are several factors causing the negative impacts within this population. In terms of obtaining basic healthcare services, patients lack access to the local clinics and hospitals. This is mainly because of transportation issues due to poor infrastructure. Moreover, there are no essential drugs or equipments available in the case of emergencies. In addition, cultural barriers certainly do have an effect. It is not permitted for women to be receiving treatment from male doctors. In some cases, if a male relative is not there to accompany the women to the clinic or hospital, they are forced to deliver the baby at home. Finally, the Taliban regime restriction on women's education has resulted in fewer female doctors and midwives available. We will now approach this public health issue using the socio-ecological model. This model focuses on how health is influenced at multiple levels, including the individual, interpersonal, organizational, community, and policy level. The individual level refers to the interpersonal factors such as knowledge, attitudes, beliefs, and behaviors. Interpersonal factors include family, friends, and social networks. And the organization level involves rules and regulations of social institutions and organizations. The community describes relationships and collaborations among organizations. And finally, the policy level deals with local, state, and national laws and policies. Now we will specifically look at how various factors at each levels could either help or hinder the promotion of maternal and child health in Afghanistan. Now, at the individual level, religious beliefs play a role in promoting health. For instance, there are quotes within the Quran that encourage breastfeeding for 2 years. At the same time, the negative opinion that patient tends to have about the profession of midwifery hinders health. In fact, the patients do not trust the midwives or consider them as health professionals. At the interpersonal level, mullahs, who are the local religious leaders, emphasize the importance of spacing out births to improve the health outcomes of mothers and infants. However, health is often negatively impacted due to the lack of knowledge at traditional ideas. Due to their commitment to customs and traditions, mother-in-laws often point out that they deliver their babies at home. So they don't think it is necessary for their daughter-in-laws to go to the hospital. Now, when considering the organizational level, the Women for Afghan Women is a women's rights organization based in Kabul and New York. This organization works to secure and protect the rights of Afghan women by participating in media interviews and trying to make their voice heard. Despite these efforts, the population still experiences the lack of access to health facilities, skilled health workers, equipment, and drugs, especially within the rural areas. In terms of community level, the health ministry works together with other organizations to educate the general public about the use and benefits of contraception. However, the population does not have access to safe drinking water and sanitation facilities. Now, finally, at the policy level, it deals with an important issue affecting maternal and child health, which is gender inequality in terms of education. The Taliban regime restricts women's education, resulting in few trained female doctors and nurses and midwives. Moreover, it is not permitted for women to receive care and treatment from male doctors. However, progress have been made over the years with the help of international aid. Specifically, the United Nations Population Fund supports the midwifery bachelor's degree programs in Kabul University. These training programs have allowed midwives to gain trust and respect public from the public. Increased number of skilled health workers, improved access to basic healthcare services, so that it helps to lower the maternal mortality. Now we can look at the evidence-based practices which can be utilized for the purpose of addressing the issue of maternal mortality in Afghanistan. To begin with, the obstetric helpline is one of the example of an evidence-based practice that could help reduce maternal health among Afghan women in order to prevent delays in reaching health care facilities during obstetric emergencies. This helpline would offer 24-hour transport response to calls for assistance. The staff would be responsible for organizing the transport, arranging escorts to the hospitals, and managing hospital admission. Apart from the helpline, an incentive for healthcare providers could be used in order to motivate health workers and encourage the use of obstetric services. Specifically, community health workers could receive a fee every time they bring a woman to healthcare facilities for childbirth. The resources needed to achieve this intervention include cell phones, improvements in roads and infrastructure, mapping of the coverage area, recruitment of taxi drivers, and the assistance of police forces. Through this intervention, deliveries with trained health workers can be increased, and 24-hour obstetric care can be made available within healthcare facilities in Afghanistan. In order to evaluate this intervention, we would collect baseline data by maintaining a record of total number of admissions for obstetric emergencies at all of the local health care facilities and clinics. And then after establishing the obstetric helpline, we would once again collect data on the number of admissions for obstetric emergencies at the local healthcare facilities after a period of 3 months, just to see if there has been increase in the number of visits, so that we would know that the intervention had been successful within the population when there is an increase in overall use of the obstetrics. Another evidence-based practice to consider would be the distribution of vitamin supplements to all pregnant women within the community. Research shows that this intervention has shown to significantly reduce the risk of maternal health. The resources required for these intervention include a record of pregnant women within the country and essential drugs that are available and affordable for the patients. And the list of essential drugs consists of calcium supplement, iron and folic acid, magnesium sulfate for preeclampsia or eclampsia, and antibiotics for managing infections. In order to evaluate this intervention, we would collect baseline data by taking blood pressure, monitoring symptoms, and taking blood tests of certain samples of patients that visit the local healthcare facilities. After the distribution of vitamins and supplements, we would once again collect data, including blood pressure and the presence of symptoms from the same set of patients that visit the local facility for health checkups after 3 months. The last evidence-based practice involves linking health worker training with literacy development. Due to cultural barriers in Afghanistan, there is a lack of literate women who could train to become health workers. This intervention requires the creation of a literacy program in combination with health education, which can be still used to teach female health workers about early warning signs and risks in pregnancy, family planning, and proper hygiene. This intervention emphasizes the importance of educating people and allows for early detection and treatment. Evaluation of this intervention would involve maintaining a record of the number of female health workers within the community. We would know when the intervention has been successful within the population when there is improvements in literacy rates and an increase in number of female health workers available for educating the patients. In process of trying to implement these interventions, there are potential challenges that we might experience. Individuals may be reluctant to participate in these interventions due to cultural barriers. For example, people in Afghanistan prefer having big families where they have average number of 5 kids in the family. Another challenge would be limited resources within the local community. And the implementation can also be difficult due to lack of trained health workers to raise awareness, provide health education, perform data collection, and improve overall health. Potential solutions to these barriers are to include making connections and building relationships with community and religious leaders, obtaining help from local community members, and organizing health awareness campaigns to promote participations in these interventions. This logical model summarizes the inputs or resources required for implementing each intervention, the activities used to achieve the intended results, the outputs or direct results of the interventions, the outcomes, and finally the long-term impact. Thank you for listening. I look forward to working with the Bill and Melinda Gates Foundation and using these effective evidence-based interventions to reduce the maternal mortality rates in Afghanistan.